Коллеги, добрый день, здравствуйте. Я приветствую вас. Давайте я
Okay, dear
сейчас
colleagues, good
перезагружу
morning
запуск
again.
полностью.
I'm switching to Russian.
Дорогие коллеги, я приветствую вас
Yes, and
на сегодняшнем
welcoming you
вебинаре
at today's
«Адаптируемся к
webinar,
изменениям. Стратегия
Adapting to
альтернативного
Changes,
финансирования борьбы с
Strategies for
туберкулезом».
Alternative Funding
И
of
пока
TB
участники
Response.
продолжают подключаться,
And
я
while the
напомню, что
participants are
вы
joining
можете,
us,
как я уже
let me
сказала,
remind you
выбрать
that you
перевод
can use
на
the
предпочтительный для
interpretation
вас язык,
channel,
английский или
whatever
русский.
language
И для
suits
этого
you the
нажмите,
most, English
пожалуйста,
or
на
Russian. For
нижней
that, you
панели
need to
соответствующий
press the
значок в виде
globe
глобуса, и
icon
там определите удобный для вас
and
язык,
choose the
подтвердите
channel
ваш выбор.
and
И
confirm
детальные
your
инструкции по
choice.
выбору языка вы найдете в
Detailed
том чате,
instructions on how
который
to
скинули мои
select the
коллеги.
interpretation channel are seen in the
И я
chat.
еще раз приветствую тех участников,
And
кто же
I'm
подключился
welcoming those
еще,
who
сейчас
have joined us
подключается
later
на
and
нашем
are still
сегодняшнем онлайн
joining
мероприятии,
us at
посвященном
today's online
возможностям
event
адаптации к
dedicated to
новым
the
условиям,
opportunities for adapting
которые
to new
сложились в сфере борьбы с
circumstances in
туберкулеза.
TB
И меня
response.
зовут Юлия
My
Каланча,
name
я
is Yuliia
исполнительный директор
Kalancha. I'm
Европейской
the executive
коалиции по
director
борьбе
of
с
the
туберкулезом.
European
Сокращенно мы называемся ЕПТБ.
TB Europe
И
Coalition,
сегодня
TBEC
я
for
буду
short.
модерировать это
And
мероприятие.
today I will be the
И в
moderator
условиях
of
сокращения
the webinar.
финансирования и замораживания
As
программ
we have
мы в ЕКТБ решили,
reduced
что
funding
будет
now and
очень
suspension
полезно
of
поделиться
programs,
друг
we
с
at
другом
TBEC have
возможными
decided that it
стратегиями
would be a great idea
альтернативного
to share
финансирования и
possible
практическими
strategies for
рекомендациями по
alternative
поиску новых
funding
доноров.
and practical
И
recommendations
мы
on
пока
finding
не обладаем
new
полной картиной
donors. And
кризиса и
so
думаем,
far,
что
we don't
он
have the full
будет
picture
набирать
of the
обороты в
crisis, and
связи с
we believe it is
геополитическими
going to
изменениями в
get
частности.
worse
Но
because of the
хотим
geopolitical
поделиться
changes. But
некоторыми
we would like to
данными
share some of the
по
data
результатам глобального
with
опроса
regard
сети
to
неправительственных организаций
results of the global poll of the
ECVA
network of
среди 246
non-government
НКО и
organization
сетей по
ECVA
относительно
out of
влияния ввода
200,
новых
almost
иностранной помощи
250
США на
NGOs with
различные
regard to
гуманитарные
suspension
программы.
of
Отмечено, что
USAID for
ограничения
international
коснулись от
humanitarian
63
programs. So
до
we see that
79
63 to
НКО и числа
79
респондентов по
NGOs from
регионам
among the
и наиболее
respondents
наибольшее
in
количество
different regions
затронутых НКО
have
по
been
всему миру и
affected,
числа
and most
респондентов
of
это из
all
европейского региона, их
were the European
79%.
region
На втором
NGOs. They
месте
were most of all
76%
affected.
из Ближнего Востока и Северной
67%
Америки,
was in
а на третьем месте
Middle East and
74% из Азии.
North
То есть можно говорить на самом
America,
деле о
and third
катастрофическом
is
влиянии
Asia.
именно
Well,
на
we
наш
can see
регион.
that it's a catastrophic impact
78%
on our
респондентов
region.
отметили, что ограничения
78%
коснулись
of the
контрактов на
respondents have
сумму
said
более
that
100
the
тысяч долларов
limitations affected their
в США,
contracts
а
amounting of more
39
than
респондентов
100,000
отметили,
US
что
dollars,
ограничения
and
коснулись
39
контрактов свыше 1
respondents
миллиона
mentioned that
долларов в
it
США.
affected
И это в целом
contracts
говорит о
with the
масштабах
value of more than million
приостановленной работы
US
гуманитарных
dollars,
проектов,
and that
которые, по
shows
всей
you the
видимости, в скором времени
scale
приведут к
of
значительно
suspension
негативным
of
последствиям.
programs in public
Ну,
health,
а
which
если
will
сосредоточиться
soon
конкретно
lead
по
to
действиям
negative
приостановки
outcomes. And
финансирования
if we speak
USAID,
about
то по официальным данным все
USAID's
гранты,
funding
касающиеся борьбы с
suspension, according
туберкулезом в
to the official
европейском
data,
регионе,
all the grants on
составляли
tuberculosis in the
сумму более
European
пяти с
region
половиной
amounted to
миллиардов
more than
долларов США. Это, как вы
5.5
понимаете,
billion US
подчеркивает
dollars. You
масштаб
understand
проблемы, с
that
которой мы
it just
все
underscores the
столкнулись. И для
scale
того, чтобы
of
хоть
the problem we
как-то
have all
попробовать ей
faced,
противостоять, Европейская
and
коалиция силами
trying to
секретариата и
somehow
членов
respond to that,
правления организовала
TBEC, through its
этот
secretariats
двухчасовой
and the
вебинар,
board
и
members,
мы
have
уверены,
organized
что
this
информация,
2-hour
озвученная
webinar,
сегодня
and we
спикерами,
believe that
будет
the
действительно
information
полезной для вас.
provided by today's speakers
Ведь
will
для
be of
всех
use
нас
for you,
крайне
because for all
важно
of us
сохранить
it is
жизнеспособность наших
crucial
организаций, чтобы
to
продолжать оказывать
maintain
помощь
our
людям и сообществам, которые стоят за нами,
organizations
чтобы не подвести их
operations, to
и
support
продолжить
the
начатые
communities,
инициативы,
to
ведущие к
not
устойчивому
let them
изменению.
down, and continue
И
with the
прежде чем
initiatives
мы
leading to
перейдем к первой
sustainable change.
презентации, я хочу
And before we
поблагодарить
switch to the
региональную
first
платформу
presentation, I would like
ПЕЦА
to thank
за
the Regional
предоставленную
ECA
помощь
region
в
platform
обеспечении перевода
for
на два региональных
the
языка,
support
а
with the
также сделать пару
interpretation
технических
to the
объявлений. И
two
первое — это
regional
напомнить о том,
languages.
как вы
And I would like also
можете
to say a
просматривать
few
презентации на удобном вам
words about
языке.
technical issues. First
Для этого
is
необходима
about how you
компатибельность от
can
версии Zoom,
view the
используемой на
presentation
вашем
on the
компьютере
language
или
of your
мобильном
choice.
устройстве,
Well, depending
выбрать
on the version
на
of Zoom,
верхней панели
you need
инструментов
to
справа от зеленой
select
флажки поле «Настройки просмотра»
the
и
view
выпадающем меню
settings
поле
menu on
«Демонстрация
the top
экрана».
to
Или
the
же,
left from
если у
the
вас обновленная
green
версия
tab,
Zoom,
and
вы на
the
верхней панели
demonstration of a screen, or if you have an updated Zoom, you just choose the tab with the necessary language and to watch the presentation either in Russian or in English.
Подробную
So
инструкцию сейчас мои
the
коллеги
detailed
должны были уже
instruction
скинуть в чат. И
should
если
already
будут
be in
какие-то
the
вопросы,
chat.
пожалуйста, напишите их в чат, мы
You can look
оперативно
up,
ответим.
and if
И
you have any
также, чтобы всем
questions,
было комфортно во
please
время
ask. We
встречи,
will try
пожалуйста,
to
не
respond
отключайте микрофон во
quickly.
время
And
выступления спикера,
please do
чтобы
not
избежать
turn on your
фонового шума.
microphone
И
when
также
you're
из-за
not speaking
особенностей настройки
to
демонстрации
avoid
слайдов постарайтесь
noise.
не нажимать
And
кнопку
also,
демонстрации
please
экрана, чтобы
don't
случайно не показать свой рабочий стол
press
другим
share
участникам.
the
И
screen,
еще один момент, на
not to
который я
show
хотела бы
your
обратить внимание, это не
desktop to
водите
other
курсором,
participants. And
пожалуйста,
also,
по
please
экрану
do not
презентации, так как
move
это может
the
оставлять следы
mouse
и немного
pointer
мешать
across
просмотру.
the
От спикеров буду
presentation
очень
because it
просить
really
говорить не
may
слишком
leave
быстро,
some
чтобы
marks. And
переводчики
speakers, please do
успели
not speak too
обеспечить
fast so that
синхронный
the
перевод.
interpreters
Спасибо вам большое за
are
понимание и
able
поддержку в
to
этом вопросе. И
translate
теперь,
what you say.
после всех уже
And
организационных вопросов, я с
after
большим удовольствием
these
приглашаю к слову
all
свою коллегу,
technical things,
программного
I would like to
менеджера
give the floor to
Европейской
my colleagues,
коалиции
programmatic manager of
Владу
the TBEC,
Рабинову, которая
Vlada
поделится на
Rabinova,
работе
who will
секретариата ЕКТБ
share
для
the
обеспечения и укрепления
ideas
устойчивого
of
развития
the TBEC
организаций
Secretariat
гражданского
with
общества и
regard to
сообществ.
sustainable
Влада, тебе
development
слово.
and maintenance of the NGOs and community-based organizations. Thank you, dear participants. Thank you, Yulia, for the introduction and for the presentation of the general picture. Recently, we have been seeing the reduction of funding of TB response and other areas, and that really affects the involvement of the communities in TB response. So the organization is organized to support people from the community, but if it's not sustainable, it may get into crisis itself. What affects the sustainability? Dependence on one source of funding, lack of planning and risk prediction, weak internal processes, and lack of institutional capacity, lack of communication with donors and partners. And the biggest challenge that we have is not just to survive, but to continue work effectively. And we would like to share with you some ideas about sustainable development tools that will help you to get prepared to these difficult situations. The next slide, please. So, for an organization to work effectively and sustainably, it must have a strong system of management and clear and diverse fundraising mechanisms. We use the following tools that help us make ends meet in this difficult time, and I will speak about that in more detail now. So the comprehensive organizational governance and policy is important because without that, the organization will not get the donors' trust. Fundraising strategy is a plan for funding. Donor mapping, it's important to understand who already funds similar projects and who will be interested in you, and how you can meet the requirements of the donors. Partnerships and coalitions, organizations that cooperate with each other have better chances to succeed. For example, when they write applications to grant, when more than two organizations write an application, it makes the application stronger and more competitive. Besides, partnership is not just about resource support in difficult times, but also having the allies in advocacy, because they will support your initiatives, they will sign up to the important petitions, support your in advocacy and communication campaigns. That's a strong tool to improve the visibility of your organization and strengthen its position not just on the national but also on the regional level. That's why partnerships are everything to us. Proposal submission calendar is the operational tool that helps the organizations to effectively plan their work, improve their chances to get funding, and not to miss important fundraising opportunities. The next slide, please. And now we'll speak in more detail about every tool. For example, organizational governance and policies set. Most organizations have the package of necessary documents and policies according to the law of their state, and some policies set according to international standards, for example, ethical code, procurement code, money laundering code, and terrorism funding code. Yes, HR procedures, and so on. But what are the benefits from having such policies? First of all, that's meeting the international standards, which makes the organization more attractive to international donors, strengthening the internal management, reducing the risks, and improving the efficacy, getting more trust from the partners, stakeholders, and regulators, and the opportunity to take part in international consortiums where having the comprehensive policies is an important selection criterion. And we often see that the donors prefer the organizations that are already sustainable structures with good internal policies. So the organizations choose to have the minimum set of documents. Most of all, they look at the UN requirements. But big donors like United have special requirements such as the quality policy, lessons learned policy, management of risks, and so on. We have prepared an extended package, and we are willing to share those with the civil society organizations. Upon your request, we will give you access to the templates of these documents on Google Drive, and you can adapt them to the specifics of your organization. To get the link, please send the request to our formal email that you can find on this slide under the list of the procedures. It's in red. We'll be happy to share the access to those tools with you. Next slide. Now we will speak about fundraising strategy, which is a clear plan to attract funding, helping to avoid drastic crisis and dependence on one source of funding. It's especially important for CSOs that have been receiving funding from a single donor for years. And fundraising strategy mostly is composed of various blocks. We will mention some of them, and some of them you know yourself. For example, introduction and situation analysis, that's the mission and goals of your organization's analysis of the current sources of funding, and SWOT analysis. Fundraising goals. You always need to understand what goals you have for 1 year, for 3 or 5 years. What are your financial goals? How much money you need to raise? What are your non-financial goals, like strengthening partnership, improving the visibility of the organization? You need also to include that into the fundraising strategy. Analysis of potential donors is about mapping the donors who could become a donor for your activities. What are the sources of funding? International grants, grants from domestic donors, public funding, including social contracting, private funding, corporate social responsibility, crowdfunding, and donations, social entrepreneurship. Also, you should have some fundraising methods and tools written down. That's grant fundraising, preparing applications, looking for all sorts of competitions. It may be some sorts of auctions, campaigns in social media, like crowdfunding, collecting donations, partnership activities, and maybe you have the membership fees and corporate sponsorship. We also need an operational plan. That's grant application submission calendar, people responsible for that, how the resources will be distributed to different activities. Maybe in your organization we have some financial capacity to hire a consultant who will help you with writing applications, that would really be great. We also, in this fundraising strategy, have monitoring and evaluation. That's the amount of funding attracted, the new donors, partners. Maybe you need to adjust your plans based on the results. And the next thing is the donor communication strategy. Development of the interactions with the donors, personalized reports, transparent uh, reporting, accountability, posting your reports on the website and in other formal sources, positioning and brand of the organization. And of course, you need to write the plan for sustainability and income diversification plan, what financial reserves you have, what social business you have, and some plan to switch to sustainable models. And the fundraising strategy must always be flexible. It's not carved in stone. It needs to be adaptable and take into account the political and other changes.
And now we would like to discuss a practical tool, which is donor mapping. For several years already, TBEC has been working on an Excel table that is regularly updated because we have new donors joining, and we find out information about them from colleagues or from different websites and portals. And this is the structure: the donor type, name, region, eligible application, who can apply for the donor's support, and priorities for funding of the specific donor, and their website. Donor mapping is not exhaustive. Well, and actually, we have not covered all the donors yet, but our table at this moment includes over 40 donors, and we wanted to share this tool with you. So, next slide, please. So on this slide, you can see a QR code, and you can scan the QR code to actually get an access to this donor mapping matrix, and you can download this matrix, their contact information, their grant priorities, and we would recommend using this information for your further work, because that would make donor searching easier for you. And now I want to share some information about UN agencies and global donors. So those identified in red are the donors who have already published a call or are about to publish it soon. Please also pay attention to the GrantScope platform. This is one of the biggest granting platforms, but this is a paid-for platform, so you can actually subscribe and also use the surfing tools to find relevant grants. Also, there is a foundation called RelevantNet. It makes calls 4 times a year, and you can actually also add this calls calendar to your calendar or of applications. Next slide, please. So here you can see regional donors. Primarily, these are European programs, but also some other interesting donors. For instance, Initiative Expertise France, which also, in addition to grants, provides technical support. So you can actually file an application and then have communication with them about further cooperation. If your interventions are eligible for them, they will be happy to support them technically. Another donor VP, they actually have a call now, and they are accepting the applications before April 1. They are rather specific, but might be relevant for you. Next slide, please. We tend to forget about private sector as a potential donor or national agencies. And even though their grant programs might be not so foreseeable or predictable, they are very important source of funding. That's why they are on the list. We monitor them, we analyze their priorities in order to meet the priorities better, and try to keep in touch with them so that we could respond to any opening opportunities for cooperation. Next slide, please. Well, we have also included governments and embassies on the list during the mapping because they are also an excellent source of funding. For instance, the Canada Fund for Local Initiatives is a very good potential donor. They regularly have really good grant calls. These are usually 2-year grants. Recently, they had a call targeting CA countries, Central Asia countries, and we expect that towards the end of 2025, beginning of 2025, they will have a call opening for Moldova, Ukraine, Azerbaijan, Armenia, and Georgia. So keep a close eye on this donor because there could be opportunities for your countries as well. Also, we have created a list of embassies and we primarily focused on those embassies that we have in Ukraine, but you can do a similar mapping for the embassies in your country following the same principle. For instance, the British Embassy in Ukraine now has a very long-term grant call for 3 years, about 7 million pounds. And it is also important, though, that they are focusing on a consortium. So you cannot apply as an organization. You need to create reliable partnerships, consortia, and then apply. Next slide, please. Another reminder, this map of donors is not just a list of grant calls or donor names, but it is also regular updating. So if you continue working on this updatable list of donors, you will always at all times have a good donor basis. And we also have an additional tool, which is a proposal submission calendar. It is very easy. Donor upcoming deadlines, partner identification, assignment of a responsible person, and list of interventions. This actually helps you systematize your fundraising efforts. There are donors who have regular grants. They automatically are added to our calendar, but in addition, we'll also do some analysis so that we would not miss any chances for funding or grants. So usually once in 2 or 3 months, we update this calendar. This is absolutely sufficient to keep this calendar and this database alive. Another important tool is this last point, list of interventions, because we regularly submit proposals. Some are followed with interventions, some are not, but some of your proposals that do not win a particular grant could be used in the future. So please store them, and you can use them later on, saving your time, adapting your proposals to the requirements of a new opening grants. And this is actually a good prerequisite for successful submissions. So we do hope that these tools will be useful for you, that you would use these tools in practice, and they help you become more sustainable. Last slide, please. And of course, we're always open to for information sharing. Please, you can reach out to us, and for those who want to join TBEC, Here is a QR code that you can scan and fill out a form for joining TBEC in order to stay posted. Thank you so much, Vlada, for systematizing the practical tools for sustainability that the European Coalition is using. I want to remind you, colleagues, that we're going to share all the presentations with you later on. And if you want to get this package of policies that Vlada mentioned in her presentation, please email us to the address that we have posted in the chat several times already. And we continue our dialogue, our conversation about the potential regional donors and the opportunities they are offering to us. And again, you can ask the questions, I remind you, after you hear all the presentations. Please post your questions in the chat box, indicating who you are addressing your question to. And we're going to have an interactive discussion towards the end of the webinar to have a roundtable discussion about the potentials, the opportunities for funding in the region, and the actions or steps that NGOs might take. And before we start our next presentation, my request to you would be to switch on your cameras so that we could make a group photo. Please switch on your cameras now. Colleagues, could you please remove the presentation from the screen so that the presentation could have their cameras on and we could make a good photo. Colleagues, please let us know when you are done with the photo taking. We are over 100 here at this webinar. I'm sure that the presentations to follow will be even more interesting, more practical for you in your work. So when we're done with photo taking, please let me know. It is a pleasure to see so many familiar faces: Lena, Ina, Sergei, Baki, Datsha, Natasha, Irina. So nice to see you, Chinara. Thank you for joining. Thank you all for joining, colleagues. So are we done with the photos? Colleagues from TBEC, are we done with the photos? Yes, we are done. Okay, super. So thank you, everyone. And traditionally, of course, we will be sharing these photos and any information about this webinar on TBEC resources. And now I want to hand it over to our long-term partner, Cristina Celan. She is program coordinator of the PAS Center in Moldova, and Cristina will be sharing some practical recommendations and examples from country cases regarding partnership between the donors and civil society organizations, as well as civil society organizations and country partners. Over to you, Cristina.
Good morning, good afternoon, colleagues. Nice to see so many familiar faces here. As Yuliia properly introduced, I will be talking about the potential partnerships and possible partnerships with the governments and how the NGO can get funds from the governments, and also bring few examples from the regions which show several options of those funding. Next slide, please. We know that the NGO play a critical role in the public health, particularly in TB response in our region. But what we also know is that we are depending still on the donors. Although I would say that our region is among the first which are more prepared and started overtaking the funding of the NGO services. And governments started to recognize NGOs as key partners, but funding access remain limited and complex. Actually, I had a discussion during last week with some government officials from our region about the impact of the funding freeze or funding stopping already. Already in 2 months, there is a big impact of the stop work of the NGOs. So governments also see the importance of the work of the NGOs, and I think that governments in our regions are quite ready to support and to advocate together with the NGOs for financing of services provided by NGOs. Next slide, please. If you can take 1 minute and screen the QR and let us know how do you think government can fund NGO. You can scan the QR, or you can go to the slido.com and include the number for these specific questions, and we'll take like 30 seconds, 1 minute maximum. So you can share which are your thoughts, how the governments can fund NGOs. Are you able to access the link? It is an open-ended question, so you have no choices to choose from. I just want to see, you can write in English, you can write in Russian, whichever is better for you. So you can share your thoughts, how the governments can fund the NGOs. There are already some answers. Thank you for those taking the time and the initiative. We'll let like few more seconds, and then I will ask colleagues from TBEC to let me share my screen. I see in the chat that code is not working. If the code is not working, then go to the slido.com and include the number here. If colleagues from, I can share it in the chat as well. However, I see people responding. Okay, can I share my screen, Alex? Okay, so
Yes.
we have few answers, but most of so are okay. Now you probably are able to see my screen. So the most of the answers are the social contracting. I see also the matching funds and collaborative joint intervention design, the competition-based funding through open competition for grants. The social contracting is the most preferred option, or most known option for everyone. Also, people see the funding through direct funding or social tenders for concrete services, also by allocating funding in the budget, both country and municipalities budget, and by attracting external donors. Institutionalization of NGOs, adaptation of the package of services, social contracting, also involvement in development of policies and strategies, also as part of the primary health care. And I saw they can fund NGOs also directly through TB Center. Thank you for sharing your thoughts. They are right. And I'll stop share now and ask colleagues from TBEC to share the presentation, where you can see that all, and move to the next slide. And you'll see that all of your answers are there. And there are many options for the social for contracting NGOs by the state, and the first one is the social contracting, as you correctly mentioned, and it's the most used in our region, let's say, where governments formally fund NGO to deliver public services. There are also performance-based contracts where funding is tied to achieve specific results, and we also have below the outcome-based financing, which is similar to the performance-based, but it's linked to the long-term measurable results, more outcomes. There are also the government NGO grants, which these are direct financial support for projects or operations of the NGO, service agreements where NGOs are contracted for defined services and paid based on the agreed and delivered services. There are also fee-for-service contracts. Under this model, NGO receive funding based on the actual delivery of services, with the payment very tied to the number of beneficiaries they covered or specific activities performed. We already talked about the outcome-based financing. There is also subsidies and vouchers. The governments can provide subsidies to NGOs to help them to reduce some of the costs, and they also can provide vouchers for beneficiaries that receive NGO-based services. We have also the method of public-private partnership, which involves long-term collaboration between the government and NGO to co-design, finance, and implement public services. And this kind of partnership leverage both public resources and NGO expertise. There is also block funding, when the NGO can receive a lump sum funds, governmental funds to cover multiple projects, and this one is more flexible, let's say, for the resource allocation. We also have the matching funds when the NGO have fundraised for a part of the funds, and the government is complementing these sources. So there are many options we can use. We just need to look into the possibilities of our countries which are in place. And when we speak about which are in place, we do not look only at the health sector or only in TB or HIV. That's usually our area of work, but we should look in all other areas like education, social protection, and other areas in the country, and see how and where such mechanisms are in place and how they can be used for TB. Next slide, please, I'll probably go through few examples. I think in our region there is governmental contracting of the NGO in more countries. That's for sure Moldova, Azerbaijan, Kazakhstan, Kyrgyzstan. There is some experience in Tajikistan. There have been very good experience in Ukraine before the war. With several mechanisms like regional and local funding. Also, there have been some money to be allocated for the services of the NGOs and contracting of the HIV services through NGOs. I'll speak about Moldova experience because I'm coming from Moldova, and this is why I will start with this one. In Moldova, there is funding of the NGOs from governmental funds, which actually are the national insurance funds. The NGOs are contracted for prevention services like screening in TB, and it started in 2020 with a small grant of about 4,500 euro, and now this increased to up to 3-4 grants per year. And for 2025, we have committed a maximum of 115,000 euro and a minimum of 55,000 euro. Why is the minimum and maximum? Because this year the National Health Insurance is contracting not only based on services, but also put the performance-based option. So the NGOs are paid for screening, but also they can receive a higher incentive if they diagnose or find people with TB. Depending on the number of people screened, they have a certain number of people to be diagnosed among those screened. So in case they do not find anyone within those screened, they will receive the minimum amount. In case they find people with TB according to the scale put in their contracts, they may receive the maximum amount that is budgeted for them. There is also 2% tax law benefits, which is in place in Moldova for all the registered NGOs in any place, and also other type of association organizations. They must be registered under the Ministry of Justice. So individual can donate 2% from their income tax to a certain NGO. That's not big money, and that also comes with a lot of bureaucratic things and limitations for the donations. However, that's a possibility to ensure at least some overhead costs. But here there is need of advocacy, informational campaigns, so the NGOs can receive this money from the people. And also the law under local public administration is permitting to the local public administration like municipalities, villages and so on to give grants to the NGOs, including health and TB. Next slide, please. The other example in the region is Kazakhstan, where social contracting has been in place since 2005, and since 2017 it started to be expanded for TB. It also increased during the years, and growing from four contracts in 2007 of about 20,000 tenge to 13 contracts to 2024, which amounts 272 2010. And currently, in 2024 at least, there were about 30 NGOs involved in 13 regions in delivering awareness campaigns, psychological support to vulnerable groups, and treatment adherence support. However, there are issues, as for the Moldovan example. Also, there are procurement issues and need for a standardized approach, and the NGOs need to have the standardized package in place, and this is, I would say, criteria for all the organizations to receive the funding sources for NGO. Next slide, please. This will be the example of Azerbaijan, where there is an agency for support to NGOs, which was created in 2021, replacing the NGO, the Council for State Support to NGOs, that was created, I think, in 2005, and they are providing small grants for civil society. Some of our partners already received such grants. They are not very big. They are mostly for awareness, and it's not like a very TB is not usually a priority, but through advocating, NGOs can raise and put at the table this subject as one important. And also, country can see the possibility to receive service agreements. The NGOs can should look into the possibility to receive service agreements from TBEC, which is the authority like National Insurance company, so which are contracting the health facilities. They should apply. They may apply the same approach to the NGOs with a sustained advocacy and increased push on the agenda. Next slide, please. As I said, we can look into innovative funding sources for NGOs, like innovative tax donation models, public-private partnerships, performance and outcome-based contracts, depending on the country. What is needed now for the organization are to look in the possibilities in the legislation of their country to see which of the mechanisms may be already in place, or for which the national legislation is more friendly in the way it can be advanced quickly. Next slide, please. And how the NGO can secure government funding. Of course, first of all, the main partner is the Ministry of Health, and closer to us in TB is the National TB Program, together with the National TB programs under the Ministry of Health. Only we can advance the contracting and the importance of services that NGOs are providing, as well. For a correct and qualitative service delivery, there is need for standardized approach, and the services should be according to a certain standard, and we have the standardized package at the regional level. We have them adapted to the country level. They should see how they can be operationalized at the maximum, and also advocate with the local governments, where in countries there is possibility to receive any contracts or any grants from the local governments, as well, to document impact effectively. Show your work. Do not forget to document what you are doing, to show the case, the best cases, and to prove that this is efficient. Next slide, please.
Cristina, sorry, just a few minutes left. Okay, thank you.
Of course, domestic funding is the future, and the NGO must strategically cultivate domestic funding sources to reduce dependency on international and financial support. There is need for continuous advocacy for crucial mobilization of the government resources. And as well, NGOs should prove a strong financial and programmatic management in order to be selected and to receive those funds. I'll stop here. Next slide. Thank you, everyone. And sorry if it took longer than expected. Thank you.
Кристина, благодарю тебя. Сейчас, одну секунду, я почему-то слышу себя.
So much, Cristina. Thank you so much, Cristina, for sharing your ideas and practical recommendations for cooperation with national authorities. And again, amidst the current global situation, I think this is something to strengthen within the countries, and cooperation with governmental partners with certain time would enlarge and enhance the opportunities of NGOs. And in the chat, we are going to share this package of community-based support services for improving TB outcomes, which should be helpful. And now we are going to discuss with potential cooperation with farmers as private business representatives. And I want to invite our regional partner, Denis Godlevsky, Regional Cooperation of the International Cooperation in the EECA region. Thank you. And over to you, Denis. Hello. Thank you, Yuliia. Hello, colleagues. I hope you can see and hear me well. And next slide, please. And I would start by sharing the following. Over the years, I have been working in this sphere. I have we could die if it some others believe that farmers are pure evil because they make money on diseases. Some have a more balanced position somewhere in between these two. But in reality, I think it's up to you to decide it for yourself. But it's definite that we will have to cooperate with farmers within this format or another format. Sometimes it could be advocacy by the community targeting the farmers. Sometimes it could be some joint efforts. So this way or other, there will be cooperation, there will be interaction, and we need to be prepared to shape this interaction in a beneficial way. Again, drawing your attention to what Vlada previously said about the code, whatever you call it, but this code should protect the organization from any donor influence on your organization, so that no donor, no matter how much they invest in your company, would dictate you what to do, because you need to protect your mission. Your mission is to serve your clients. So what are the potential opportunities out there to interact with the farmers? First of all, they can provide financial support, be it urgent or long-term. Farmers also have open grant calls. We will discuss them later. Also, you can actually partner with them like with any other private donor that do not have like regular rounds or regular open calls for proposals. You can cooperate with them in between or on the individual basis. You can get products from them. You can have them support your research or surveys. So now about the ethics, as I mentioned before, your organization should be ready to cooperate with the farmers. You need to be as transparent as possible in your reporting and the governance of your organization to avoid potential conflicts of interest. Just similar to what I showed in my first slide. Like, for instance, if I received any premium from any pharma company for speaking to you now, then on my first slide, I would just indicate make a disclaimer that I have been invited to speak to you by a certain pharmaceutical company, because that could influence whatever I'm telling you. And this is something that you need to remember. And those of you who have attended international conferences, you have probably seen very famous scholars presenting at international congresses and conferences always displaying such a disclaimer slide, indicating that a farmer has supported them in their research, in their participation in the conference, etc. And I would tell you even more, a pharma company supporting you would even demand you to do so, because big farmers have compliance requirements, and compliance actually means preventing any potential illegal or illicit activities. And you are going to hear this word compliance a lot once you start working with farmers, because farmers have lawyers who keep a very close eye on compliance requirements. And I will share about this later when I speak about contributions, material contributions. But anyway, any farmer is going to request or demand it from you to meet the compliance requirements, and also do your best to prevent farmers from dictating you something, to avoid a situation with some philanthropists who believe that if they give you money, they can dictate you the conditions of the game. So what should we start with? Again, we need to know the farmers. Of course, we all need to know our clients, but we also need to understand which businesses you can approach. And it would be good to do some mapping, as Vlada mentioned before. And you need to understand what are the domains that you are working in, who or which companies produce the relevant medications. You need to find out if these have regular community support initiatives, and is it possible for them to provide individual support to an organization. So how can you do it? How can you look up this information? So we all have different audiences. So some things that I'm sharing now might seem funny to you, or very simple, but I'm telling you this so that you would understand that it is not as scary as it might seem, or as complicated as it might seem, because whenever you take a box of a medication, you can read who or which company is the producer of this drug, and then you can just Google this company or use a GPT chat or any other server to look up some information about this producer. Or if you don't have a box of medications, you can actually find this information from open sources, because the Ministry of Health, governmental agencies usually have lists of producers. And this is the way you can get their contacts. Another way to get their contacts, to get in touch with the producers, is attending conferences, attending exhibitions and shows, because the producers usually have their stands, their representatives there. You can come up to them, you can ask for their business cards, you can even meet a patient relations or community liaison officer there, because all the farmers that produce generics produce brand medications usually have these. Companies producing generics do not usually or not always have them, because these officers in such companies are called public relations officers, but it's just the name. The mission of this person is the same, and it's what is important for you is to remember that you need to contact someone who is responsible for potential cooperation with your organizations, and you need to do it at the national, regional, or international level. Of course, international conferences are rather costly and rather rare, national conferences are held more frequently, and in most cases, national conferences on certain decisions, on any decisions actually, they are funded by the pharma companies, and the pharma companies are usually present there at the conference. Usually, you should not necessarily try to find a TB conference. You might look for some supporting or additional events related to healthcare coordination. It might be called business and pharmaceuticals, or it could be Adam Smith's forums, or pharmacoeconomics. So look for some other names. In most of the cases, registration for this event is paid for and rather costly, but sometimes you can contact the organizers directly, and they can provide some privileges to NGOs, either allowing you to attend free of charge or pay for your participation from some other grant. And you can also ask managers of your medical healthcare facilities to help you contact the farmers, because they usually have sales reps coming to them from the pharmaceutical companies, who come present their products. So maybe the general physician, the clinic director is going to have this information.
And here you see two blocks. Each of them needs to be considered based on the colors. So the way you get prepared, and what's important when working with any donor, including pharmaceutical companies, we start with the brown one. We need to clearly understand which personnel will do fundraising or interaction with the pharmaceutical company. There can be different approaches. It can be a fundraiser, and if you don't have a fundraiser, you can split this function among the project coordinators, who are to develop project applications, and that there could be managers, senior leadership, and so on. The people in your team involved in external communications, not just with donor, but first of all with donors, they need to clearly understand your priorities. What you use the funding for. And if you look at the green, those can be pills, that can be funding of your core activities, the projects, the research activities. Then you look at the red block. Always consider the dialogue with you from the other side. Imagine that you speak with yourself, but as your sort of counterpart. Why cooperating with you is good for them. And some things that I will be speaking now about are maybe cynical, but for us as non-commercial organizations, well, we mostly speak about the communities, human life, values. It is cynical, but the pharmaceutical business is first of all business. And of course, all of them, they have those beautiful slogans and missions about social importance and responsibility and helping the patients, but it's a business. And it's important to remember that. So when you speak to them, you need to, well, speak about what's important and profitable for them. And blue is blue square is you being specific, what specifically you're going to produce, how much, and so on. So practicality is also important, so that the most important this external thing is when you go to the conference, meeting some potential donors, you need to deliver the message within a minute. You need to have this 1 or 2 minutes message. You will not have time for anything else. You exchange your business cards, you provide some message which is maybe not an advocacy but fundraising or just to get them hooked. Then you need to be ready to a micro pitching, like 3-5 minutes message, because like sometimes in the film movie industry they do this way, like you come there, you provide explanation about your concept of a film, how much money you need and what result you expect. That's the second level. Third level is specific negotiations considering the priorities, and I'm not speaking about open competitions announced publicly everywhere and everything is described in the project proposal, but I'm speaking about your individual talks with the company as a philanthropist about a specific grant to support a particular initiative. And if you have reached the project proposal or donation agreement, that's the final stage. You've done good if you're there. Next slide, please. Here, well, so that you don't have to look for the lists of originators and generics producers. On the top of the list are people who produce something for tuberculosis, like Pfizer, and generics, all of them do something for tuberculosis treatment. Now, what's the difference? The originators mostly, almost always, have open competitions on the sites with clear specific procedure, how you can apply outside the contest if you need some specific support. Next slide, please. Generics, they don't have it, unfortunately. That's how it looks with the originators. ViiV has it on the site. You just Google ViiV funding for patient communities. Pfizer, they all have such grant portals or sections on the official website. Everything is clear. You can understand whether you are eligible for their priorities, whether you can submit out a competition proposal or not, and so on. With generic manufacturers, you need to, well, establish direct contacts, maybe through your country, maybe through some people you know, through some acquaintances, but it doesn't mean that generic companies are not willing to fund some of your initiatives. It's a bit difficult, yes, but they are willing to do that as well, because their business is also evolving, their culture is growing, they start working with the patient organizations. Next slide, please. Another important example I would like to present is product donations. In the current situation, when everything is so bad with USAID and we need to get pills somewhere fast, this can be a relatively fast way to close the gaps because, well, it never has worked faster than a month and a half, and you need to take into account the compliance. Some companies will provide you with their own tablets to deliver to the patients as a donation. Some do not do that because it will be considered a promotion of their goods. Then they may provide you with a grant to procure the tablets from an independent contractor for your particular needs, and you can buy, I don't know, 10 different pills from different manufacturers. So it all starts with the letter. You can actually just send to the address in their email, or you can learn the contact data of the country representative of the company, and it's better to start with the manufacturer of the pills that you are lacking. Particularly now you describe your situation, you're saying we have a deficit of the medications, this many medications, and so on. In some countries, national regulation prohibits unlicensed patient organizations from receiving such donations. Maybe you need a license for storage, for custom clearance, and so on. But you need to consult with lawyers. Your NGO closes a contract with, for example, a private clinic or public clinic, or with some drug store, drug warehouse, yes, and the NGO is responsible then for finding the beneficiaries and delivering the medications to the beneficiaries, getting the receipt notes from those beneficiaries after the medication is delivered, and storage, cold chain, and so on is the responsibility of the public or private partner, the clinic or another company. You just need a lawyer for that. The next point. Here you see the example in English at the ITPC site, where we, together with an NGO, for the first time during COVID, were able to receive such a donation to help people who got stuck in some foreign countries and could not leave, could not return home because there was no transportation available. On the left there is algorithm, on the right is the example. You will have time to read it at your leisure, because we don't have a lot of time now. Next slide. Well, something that is the least expensive, if we compare it with the research or the grant or any other kind of support, is support of your conference participation. Suppose you have submitted an abstract that has been accepted at a conference. They have paid for registration, but they cannot pay for your accommodation and travel. Now, in this situation, you can quite often ask a pharmaceutical company, especially if you have some already good relations with them, like you've done some projects before, so people are aware about you, they know who you are, because you just go a person from the street coming to them and saying, support me. It will be, well, difficult, but you also need to consider compliance and conflict of interest, disclosure, and so on. But that's a way for you to take part in a national or international conference. Next slide. So that's the final block I'm going to cover now. That's about ethics and understanding of priorities. Of course, we appreciate all donors who support our work. I mean the sector, because of course every organization appreciates help. But why I'm mentioning all the time that pharmaceutical companies are businesses, and you need to be practical, if not cynical even. Because on the left you see the examples of the biggest grants I've found in open sources since 2020, provided by pharmaceutical businesses, and on the right I'm showing you the funds and or settlements paid before trial, yes, because of unethical behaviors of the pharmaceutical companies that were proven in those cases. And so you see that there are orders in differences. We speak about millions and billions. And except for Purdue Pharma, I think everyone has heard about this opioid marketing. They are getting bankrupt now. All the other companies, despite paying these terrible fines, they are alive and kicking, and they don't have any deficit of funds. So just remember that the amounts used to support non-commercial initiatives is very small. We appreciate it's important, but we understand that other costs of this particular private philanthropists are more important, and the profit is of the top priority for them. And you need to remember that all the time, because getting support from any private donor, included pharmaceutical company, must not stop you, neither ethically nor procedurally, from taking part in an advocacy campaign that potentially may affect that pharmaceutical company when you demand a price reduction, for example. And I encourage you to remember that, and I hope that you will succeed. Thank you. Denis, first of all, thank you very much for this interesting presentation, for being so specific in time and following your time limit, and thank you for the analysis, for the specific instruction that we will share with all the participants. This and other presentations too. And though the questions of potential cooperation with pharmaceutical companies are controversial for NGOs, we still have this objective now to present as many potential donors as possible, not to waste the capacity of the NGO and CBOs, and support the progress in TB response that have already been achieved. Thank you very much, Denise, and dear colleagues. You can ask your questions to speakers during the interactive discussion that we will have in the next two presentations all throughout the webinar, and write your questions in the chat indicating who should answer. Some people have already done that. Thank you for that.
Опыте двух наших европейских коллег и членов правления посмотреть,
какие возможности для using the practical experience of our European partners, I would invite you to have a look at what are the donor opportunities in Europe. Of course, primarily for the WHO Europe region, but also some opportunities are accessible for other regions as well. And now it's my pleasure to give the floor to Director of Romanian organization ESPTMR, Stefan Radut. Dear Stefan, the floor is yours.
Hello, thank you. Before I starting, I want to share my emotionally. I am very nervous every time when I have an English presentation, and I hope to don't speak very fast for translation. Thank you. In opening, I want to thanks to the TB Europe coalition team, because we speak about this very important subject in this actual context. We have a joke in Romania. We say the pessimists say cannot be worse than now, and the optimistic person say it is possible, can be worse. So I am Stefan Radut. I have a relative big experience in project implementation.
Dear Stefan,
12 years. Sorry.
Stefan, yes, can you speak a bit louder or put your microphone a bit closer, because the sound
yes,
is not...
sure.
Oh, super.
Now is better. Perfect. I have a relative big experience in implementation project. Now I working for a state institution for mental health, and here I'm a project advisor. I'm also TB Europe Coalition board member, ASPTMR director, and I implement project for two patient organization from Romania. And all of those because I'm a former TB patient. Next slide, please. So in 2000 years, we had a huge TB in Romania. Sorry, I made something. I think it's better now. We have a big incidence of TB in Romania. In that time, Romania was a very poor country, and because of the health system was very oldest and with huge problems. Because of that, the Global Fund start to financing TB in Romania with very good results. But after some years, the Global Fund they have an internal policy regarding the funding, and if you know, they don't funding in infinite time. When the countries becomes more stability and with more money, like Romania become an upper middle income country. You can find this definition on the internet, or you can find all the global funding policy. The global fund usually stop this financing. This happens in Romania, and but global fund is a very smart financing structure, and when they stop the financing usually projects, they have some like names. It's a transitional grant. This grant are the main scope is to help the health system to become strange enough to take all the investment that Global Fund make it and put in the national money, to say that. When we received this announcement in around 2018, I think was, NGOs and doctors and some health professionals, we was very, let's say, worried, because we was worried that the Ministry of Health cannot take all the global fund investment, and unfortunately we had right, because Ministry of Health was very difficult to take all the intervention. Some of services of move to other donors like EAA grants and Norway grants. I'm sure that you in next presentation you learn more about these donors. After that, we managed to put some activities in EU program from budget 2014-2020, and there we made advocacy to have one screening TB grant, and in that grant we was able to put also some services for patients like peer support and psychological and social support. Unfortunately, it is very important how the countries can take this money from EU, because Romania don't have big experience and big capacity, and even if the program started in 2014, we was able to start the screening project in 2018, and this because this project was a high priority of Romanian state. The other screening start more later. This grant was ending in 2023, and in next screening grant, because we have a big reduce of financing. In actual the screening grant, we don't have any services for patient. We have just screening and that. In 2023, also the Norway grant was closed. I'll speak a little bit about this grant. The Norway
Stefan?
grants was sorry.
Yeah, Stefan, sorry for interrupting. There are only 3 minutes left. Thank you.
Okay. Yes, thank you. The Norway grant is also the very with very gap in this 11 years. We had just two grants with a gap about 3 years between them, and this is very unhappy. I want to say that it is very possible every time to have remain without donors or financing institution, like now it's happened on US aid. And because of that, we need to be very adaptive. And please go in the next slide. Here we have a list of program or donors which are available in Romania and Europe. I want to say a few words about Erasmus program. This is a learning program, but we can put some activities for TB in this program, like I don't know, medical health professional training or patient training, or some which is very close with learning. You can find information on internet regarding those programs. Please go to next slide. This is very important. We will have next EU health program in 2028-2034, and it is very important for our region to put to make advocacy to put TB in this program for all the countries. Other financing, it's bilateral cooperation between countries. We have this in Romania, and we can make project with Moldova, with our neighbors. Cooperation between countries, and maybe in future we'll have a UK cooperation. I don't know, but I think will be very possible. And exploring other opportunities. It is very important to stay to thinking outside of the box. Thank you so much.
Oh, you were very quickly. Thank you so much. Да, уважаемый Стефан, большое спасибо за то, что поделились вашим опытом.
Dear Stefan, thank you very much for sharing your experience and showing that there are certain possibilities for the civil society, specifically the Erasmus program and some others that Stefan mentioned in his presentation. And I think that your presentation really offered some possibilities for continuing to work in TB control. And as a continuation of this topic, I would invite our Norwegian colleague, director of the International Foundation for TB Control, LHL International, and recently elected board member of TBEC. Over to you, Mona Drage.
Thank you, Yuliia, and thank you, Stefan. Yes, so my name is Mona from LHL International Tuberculosis Foundation, and I've been asked to speak about opportunities for securing additional funding. And my focus will be within the EU, but there's also some opportunities for colleagues from Ukraine. So, next slide, please. So just quickly who we are. LHLI, we were established in 1943 as a patient organization. And then we started working with TB internationally in the 80s, been an independent foundation since 2013. And currently we have cooperation with Norway, Latvia, Poland, Romania, Sudan, Malawi, Zambia, and Tanzania. Next slide. So we have a great variety in our portfolio, but we also have a very vulnerable funding base. It's mainly the Norwegian government. So of course that's lucky for us right now that it's not USAID, but we do feel the consequences of this for our partners and of course the whole TB community, and it's heartbreaking. So I guess that's why we're here to talk about that. So mainly the Norwegian government funding us through the Norwegian Directorate for Development, NORAD, but also a bit for the Ministry of Health and Welfare and the Municipality of Oslo. So the government of Norway has a good track record of funding civil society. In addition, some small money for private foundations, and then the subject for my presentation, EEA grants. We don't currently have any as the former project period is over, but we are now going to talk about what could be possible in the future. Next slide. So this is what I want to talk about today, the opportunities within EEA grants. It's a bit of a jungle, and I definitely don't have all the information. I'll share what I know. I'm not an expert on this. And then hopefully I can give you some ideas for avenues to explore further. But if anybody has concrete information from the various countries, it would be very good to share in the chat or in a discussion afterwards, because I'm not an expert on this. But EEA grants, it's from 3 countries. It's for Norway, Iceland, and Liechtenstein. They are providing these grants so that they can have access to the EU market. Norway grants is only from Norway and does not include Greece and Portugal as recipient countries, but otherwise the same countries. The funding cycle is 2021 to 2028, although that doesn't really make sense because one funding cycle is over and they are now negotiating for the next. And it looks like the funding and the projects for the next cycle will last until 2031. So quite confusing already there. So these are the eligible countries for funding. It's a lot of money. This is the current allocation that has been concluded now until 2031. The left column is the EEA grants, and the right one is the Norway grants. So it's the same countries except Portugal and Greece is not part of the Norway grants. So this is total sum. Next slide, please. In addition, there will be some funds for Ukraine. This was announced on Friday, so very recently, and there's not so much information. This is from the website, and it's basically what it says. They are allocating 183 million euro, and these funds will be used to support projects that address identified needs in beneficiary states and implemented across various program areas and funds. So I don't know anything more than this, but since it says across funds, I do assume that it will include civil society funding, as all the other funds include 10% civil society funding. So we just have to keep our eyes out for this. There is the link for where this is announced with this information, and hopefully there'll be more information soon. Next slide. So the EEA grants have 3 overall thematic priorities: European green transition, democracy, rule of law and human rights, and social inclusion and resilience. These are made rather broad, and quite confident that the work that everyone that are in this meeting is doing can fit under the last two priorities. If you look also, I'll show you later one of the sub priorities, but if we look in what they call the blue book, you see there's a lot of areas that you can work on under these three thematic priorities. Next slide. So a lot of this funding goes to governments or public projects. But in each country, there has to be a specific fund for civil society, and it's 10% of the larger amounts that you saw. And they are not to be, governments cannot influence what those funds go to. Next slide. So this is how it looks like. In the last funding cycle, it was called Active Citizens Fund. Now it's the EEA Civil Society Fund. And I thought I'd written something wrong, but somebody has corrected my slide, I can see, so now I was confused. Yeah, so this is the amount of money that is going to go to civil society in those countries. And I'm assuming that Ukraine, the same will happen to the money to Ukraine, but that's my assumption. Next slide, please. So these funds will focus on areas essential for the promotion of democracy, rule of law, and human rights. So it's within those broader three themes, but focus on democratic values, civic engagement, information integrity and media literacy, civil society participation in democratic processes, human rights, anti-discrimination and social justice, gender equality, SRHR and LGBTQ rights, climate action, and organizational development and enabling environment for civil society. So here also very broad priorities, but we can easily fit TB work within these broad umbrellas. Next slide. So this is supposed to be a participatory process. So it's possible to get involved. There's been stakeholder consultations for this new EEA Civil Society Fund. Unfortunately, many of them have already been held in most of the countries. So it's only Croatia, Estonia, and Latvia that is still possible to participate in. So if there are any colleagues from those countries, you need to sign up for these meetings and make sure that you give input, that they prioritize TB and public health, or whatever is your specific field. But this is a chance to influence the process in your country. These funds are managed independent of national governments, as I said, through a fund operator, or a fund operator can be one civil society organizations, and in some countries there are several that work as fund operators. It's also possible to apply to become a fund operator. I'm assuming you are getting paid for the services and that it's sort of a bit lucrative, but it's probably also a lot of work. So you have to have a very solid system in place. But that's then a country process, and the deadline is 8th April for all countries, as far as I've understood. And then the calls for submissions for proposals for the CSOs will probably be early 2026. And it's a good idea to have a project partner from Norway, Iceland, or Liechtenstein. Unfortunately, I thought Stefan would say more about that, how ASPTMR and LHLI were project partners on many of these EEA grants, and how that strengthens your application. It hasn't been a must, but to have a donor partner, but it strengthens the application. So there's the web link to some more on information on how you can be involved as a civil society organization. Next slide, please. But apart from the early 2026 calls for proposals, I think you all need to lobby your government to include TB as a priority, because it's not only the CSO grant, like I said, it's only 10%. So there's a lot of money going to these countries across sectors. So the real jackpot is if you get a pre-approved project on TB through NTP or through your Ministry of Health. Then that's what we had in Romania twice. A big project only on TB with civil society included, together with the national authorities. So that's the best. Or that you are able to secure a call for proposals on public health specifically, push your governments to include that. But these processes and who is in charge might differ from country to country, and they are somehow a little bit secret and unofficial. So you have to start doing your research. These negotiations have already started in Poland, but as far as I know, Poland is the first country, so the other countries are a bit behind. And unfortunately, the rumor also has it that the Polish authorities are not interested in including TB. So if there are some Polish colleagues here, please try and lobby, try and push, try and find out the avenues to do it, because I don't know, but I've just heard rumors from the Norwegian side. So this is the time. Push your governments for this. I think some countries even have their own ministries for this. In Romania, they have the Ministry of European Funds. So find out how it is in your country. Next slide, please. Like I said, 3 main priorities, but there's many areas of support that your governments can choose to include, and you can find them all in something called the Blue Book. That one was also released on Friday, so it's very fresh. The link is on my slide. So here is public health as an example of areas of support that can be prioritized. And you can see that this fits very well with TB. So, and I like especially the last bullet point, capacity building and patient involvement with a focus on strengthening patient rights. So if we can get government grants within public health and public health focusing on TB and patient rights, I think it would be excellent in these countries. So to conclude, there are many ways to access EEA and Norway grants. Not necessarily easy, but there are many ways. Find out which ministry is in charge of the negotiations, when they will happen, and how you can lobby to include a focus on TB. And then also get ready to apply for the CSO grants when the call comes, hopefully early 2026. Next slide. And then I just want to wish us all the best of luck, and may the force be with you or with us, and not with the US, as I see it can look like, that I've written. And thank you.
Огромное спасибо, уважаемая Мона.
Thank you very much, dear Mona, for your incredible work and the practical advice that you have given to our colleagues. I am sure that it will be very useful for them, and those who will be seeking the funding, they will have all the tools thanks to our webinar. Now, dear participants, you have a unique opportunity to ask your questions or make comments on what you have heard from the participants. Please raise your hands. We will have a discussion, and maybe you just want to say your opinion about what you have heard, or you would like to share your experience or ask a particular question to some participants, to some speakers. So I had to see that you have raised your hand, please. Good afternoon, dear colleagues. Do you hear me? Yulia, let me introduce myself because not everyone knows me. My name is Yuliia Hasanova. I work at the WHO Regional Europe Office on the United Program on infectious diseases. I didn't want to speak long because people may have some specific questions or comments. I wanted to comment the second presentation by Cristina Celan. Can I do it now? Yes. First of all, I would like to thank the organizers of the event because, as they say, it's very timely webinar, very important because of the situation that we have on our hands, and the problem affects not just NGOs but all of us in this sector, all of the people who deal with supporting the countries. So thank you very much for this meeting, and thanks for providing so many suggestions and for sharing it all with all the people. It's important to support each other. Now, even technical assistance is of extreme importance. And as far as I understand that this webinar is most of all about attracting more donor funding, but my comment is about sustainability, because the time shows that we cannot always count only on external funding, and we see how vulnerable we become when we depend on it. And the role of the civil society and the community is also very important. So I will be speaking about sustainability of your contribution in TB response in the country and supporting the national programs on tuberculosis and HIV. First of all, I wanted to say that it's very important that the organizations of civil society are sustainable and vital partners to the national programs. You have your role. You're not playing secondary part. You have your role, which is important. And my message now is targeting the NGOs that work at the national level. Please contribute as much as you can and prove that you are a sustainable and indispensable partner. You play the role that no one else can play, and that should be included in the strategic plans, national strategic plans. You need to clearly define your role and be active participants, starting with the development of strategic documents. I will be brief, but I just want to mention a few bullet points. Second, we spoke a lot about institutional development of the CSOs and institutionalization. What does it mean? It means that there should be some legal framework. In your country, there should be a legal framework regulating your work. Your rules, your responsibilities must be clearly defined, and we will speak also about accreditation and certification. If it is required, it will ensure your sustainable involvement. And Cristina has given a good example. We have just recently returned from the review of the Moldovan national program. They have a very good experience of involvement of civil society organizations in active screening, because they have the legal framework for that, and the country enjoys the social contracting of that. So our recommendation was to expand it to other sources too. And also we can mention the need for NGOs to do capacity building. Please think about that. In your development plans, you have to show that you have the capacity. And capacity building is an important component of development of your strategic development plans.
And the third thing that is necessary for significant, meaningful involvement of community-based organizations in national programs, it's having a tool. Just bringing the TB example, we altogether elaborated the tool, this great package of standardized services, and recommended the countries to introduce the package of standardized services provided by community and civil society organizations at the community level. So this package needs to be adopted either by the Ministry of Health or by the government of the country, and that this should be followed by very good calculations as to what should be the cost of these services. Because once you have such an approved tool, calculation tool, then it is very easy to submit proposals for social contracting. And finally, you need to demonstrate your outcome and your impact. And for this, you need to elaborate indicators. And Yuliia and her organization and ourselves are now elaborating these indicators for different countries to reflect the efficiency of intersectoral accountability in TB control. So, and you need to help national TB programs evaluate their interventions using these indicators, and it should be part of the annual reports from evaluation and monitoring of the efficiency of national TB programs. Thank you so much, Sayhat, for mentioning really key things, and it is very important to hear your opinion because you do different evaluations of national programs, and it's important that you have just shared these points with the civil society organizations so that we would use this information for further planning, because many countries are now starting to prepare the national strategic plan, so the NGOs should see their role in this and get prepared. So I can see Sergei Dmitriev has raised his hand. Yes, good day, colleagues. Thank you, Yuliia, for giving me the floor, and thank you, Sayhat, for her great intervention. I totally agree with what she has just said. I would like to add a couple of words about the resources that Sayhat mentioned. We all understand that the sustainability, services sustainability component is key now, because there is a very high risk of interruption
и предоставления услуг. Поэтому у нас
the treatment option
на самом деле это глобальный фонд, да, который пока еще работает. И у меня
funding is very, cannot hear him well, and now I think we have lost him.
Достучаться до глобального фонда, чтобы они в последний год проекта как минимум переформатировали на непосредственно компонент устойчивости, непосредственно на, как хотите его называйте, как его ранее, план перехода, потому что Сайхат говорит именно про это. Именно про это для того, чтобы все наработанное, все, что было разработано, перенести на плечи государства.
What has been already done?
Предоставление услуг, финансирование этих пакетов и все остальное.
Сережа, подожди одну секунду.
Слышно?
Дорогие переводчики, у нас нет перевода на английский. Пожалуйста, вы можете перевод на английский нам сделать? Спасибо. Сереж, да, пожалуйста.
Да, спасибо. Ну, то есть вы услышали, я, может быть, еще для переводчиков, основной мой посыл, как бы переформатировать существующие ресурсы.
And it's very important to reformat the existing resources, including the Global Fund resources, to think of how to better use this for the package of services, for providing costs, etc. Thank you so much, Sergey. Indeed, this is a very important aspect that needs to be paid attention to. Colleagues, speakers, maybe you would like to comment on your behalf, or maybe the participants have some questions, because there is still some time for questions. We have about 10 minutes more, so please make good use of this opportunity. By the way, there was a question in the chat about the calendar, the grant calendar, and I responded to this question in the chat in English, but I would like to repeat this in Russian. You can actually develop an applications calendar yourself, depending on the needs of your organization. You can use this big tool, this matrix or donor mapping matrix to start up your work. We will be sharing a link to this matrix once again, so that you could use the QR code or the link to go to the donor database, have a look at it, and based on this information, develop a calendar of your own to keep a close eye on the grants or the opportunities that the donors provide. This is just a quick comment. And one more thing, yes, over to you, Sergey. Yes, I wanted just to share, and I wanted to support Denis in what he has proposed. Indeed, we need to also involve farmers and private sector as donors. So we can see some examples from the European Union. I am absolutely sure from the recent statements of the world leaders that the donor programs are going to shut down gradually because EU countries, for instance, now are going to increase the funding for ammunition. It is going to reach the limit that has not been there since World War II. That's why they cut down the funding for everything else. So we need to understand that because of the war in the region, the Western countries, the European countries are going to cut down the funding, and the USAID funding is no more available for another reason. Yes, thank you for this comment, Sergey. We do understand this. We foresee these developments. That's why we are presenting a wide spectrum of opportunities, from private sector to the government funding to Western funding, so that you would have a wide range at your disposal and would make a decision for yourselves. Yes, indeed, the EU is cutting down the civil society funding, but there still are some opportunities. You would remember that Mona mentioned before that a new grant cycle has been already announced till at least 2028 or 2021. And there will be some more opportunities there. So what is the most important? We need to have this information, and we need to know how we can use it. If there are no other questions, then I would like to thank you all for participation, for finding time to attend our today's webinar. Hopefully you have received useful information and will make a good use of it. I also want to thank our great speakers for the valuable experience they have shared, and thank you to the interpreters who help us understand each other. And if you want to actually get access to the presentation, to any information that we have displayed today, after this meeting, we will be emailing the presentations and the information to you. And also, you want to get the policy package for getting access to grants, please email to us, to the coordinator's email, and we will be sharing this policy package with you. Thank you once again, and hopefully all together we will be able to adapt to the current change in order to win our victory over tuberculosis. We have